Well, the next question comes in from Robert, and he keeps hearing on the news that workplaces, hospitals, and long-term care homes are without PPE. This is putting the staff, patients, and others all in danger. Is there a shortage of PPE to go around and protect our frontline workers? What are the systems in place to make sure that every hospital, long-term care center is properly equipped? If I can find suppliers, can I connect them with you? This is from Robert.
Thank you for that, Kurt, and thank you for the question, Robert. I am going to ask Minister Phillips and PA Martin to comment on this in just a moment, but certainly a very important issue of personal protective equipment. And we have to protect our frontline workers so that they can protect us. And obviously, during these times, there's a high demand, not just in our community, but globally. And the private sector has stepped up. They've been critical in making sure that we have enough PPE. There were some additional financial measures that were introduced by our government, and Minister Phillips will expand on that. But, we've got to do our part. Last week I personally picked up and hand delivered to the Willowdale Welcome Center and Helen Keller Center some personal protective equipment, and thanks to those who alerted our office. That came from the community and companies like Levelware, who converted making golf shirts to making masks, and to Lifetime Developments, a home builder who has changed their business model to be able to bring in additional PPE. And so this is us. We've got to work together. We're all in this together, and certainly maybe Minister Phillips can expand on that, and then PA Martin.
Sure. So listen, when the worldwide demand for the same half dozen commodities was something that quite clearly ourselves, the federal government, local facilities, in fact, governments around the world were not prepared for. And in response to that, one of the things that Premier Ford did was fire up the manufacturing might here in Ontario. So we now have ventilators being made, masks being made, gowns being made, reagent being made, all here in Ontario. And I think to the question someone asked earlier, I think these are the kinds of things longer term we're going to need to see because we don't want to be dependent on international suppliers. And we all recall when, at least for a while, the U.S. border was potentially closed to that. Robert, you asked about how to help. If you go to, and Stan could route you to this as well, but Ontario Together, if you go to Ontario Together, it's a web portal through which any suppliers, anybody who has access to PPE, we'd ask them to just access through that, and they'll get a prompt response in terms of what we're looking for and being able to provide it and supply it so that we can then distribute it. I have to tell a little story here, if my colleagues will not mind, but about 2.5 weeks ago, it might have been 3 weeks ago now, Premier Ford started hosting hosting is a nice word for it, a daily call with the people responsible for procurement. And for those who don't know, the Premier comes from a manufacturing background, so supply chain and how these things work is something that is a degree that he has a fair bit of expertise on. And he knew as the Premier that by every single day, and every single day since then, he's been on that call, I've also joined him on that call, he is putting a focus on this to make sure that all of the energies of our government and our manufacturing sector are focused on this, and it's something to see every day, the reports coming in to make sure that we're getting the supplies that we need and that those supplies are being distributed correctly. So this is an area where we cannot rest. There's been progress made, both in terms of the delivery of supplies and the manufacturing. Again, through Ontario Together is the place to input, and we would welcome people's input and opportunities to help us with this. But because we don't know, as I said, if we're in the first period or third period of this, we need to keep those supplies coming. We need to make sure they're getting distributed, and it's just so vital to us being successful in what we talked about for the economy in terms of that ability for us to restart and then recover the economy. Is there's a few very key dependencies. One of them is PPE. Robin, did you want to add anything?
Well, that was quite an extensive answer from both of my colleagues. Maybe I can just say from the health perspective, we have managed to up our supplies for PPE, and so we're delivering to any healthcare organization or healthcare provider or group home or other that requires PPE in a 24-hour period now. We still need more supplies, as the minister said, because we don't know how long this is going to go on. And interestingly, people probably don't know this, but our healthcare system mostly has these healthcare providers working fairly independently in normal times. Most of them get their own personal protective equipment from their own suppliers. And so what we've had to do is create also a centralized system. So if people cannot get them from their own suppliers because of the constrained global market, the ministry has also undertaken to acquire stuff, keep it in a warehouse, and distribute it wherever it's needed when anyone calls and asks or emails and asks. And we have a process for doing that. We have regional leads for personal protective equipment in each of the areas. And so we're now working much better that way to make sure that the supplies get out to everybody who needs them right away. But all of that didn't really exist before COVID-19, and we had to create it. And we have to keep inventories so we know how much each hospital or long-term care facility is using so we can anticipate what their demands will be in the future. So it's kind of a complicated thing that we've created, but it seems to be serving us well now. I just wanted to add that part, and I encourage anybody who knows anybody who has personal protective equipment that they would like to donate and or to make an offer to sell, to use that Ontario Together website, because all of us are trying to do our best to make sure that we have all the resources we need going forward. It's so important to protect our healthcare providers. Thank you.